Most people think assisted living costs about $3,000 a month. The real national number is over $6,000. That's $75,000 a year, just for one person. And here's the part nobody tells you. The price swings wildly depending on your zip code. The same care in the same month can cost twice as much one state over. Some families pay $4,500 a month, others pay $11,000 for almost identical care. By the end of this, you'll know exactly where your state lands and what's quietly driving these prices up every single year. The real national average broken down. Let's start with the big picture number. In 2026, the median cost is around $6,300 monthly. That's roughly $75,600 per year. But median hides a lot. The actual range runs from about $4,000 to almost $11,000 a month. That's a $7,000 swing every single month. Here's what's baked into that base price. Usually a private or semi-private room. 3 meals a day, housekeeping, and laundry. Help with bathing, dressing, and medication reminders. Sounds comprehensive, right? But most communities use tiered pricing. The base rate covers light assistance. Need more help with mobility or memory care? That tier jumps significantly. A move-in fee adds another layer, typically between $1,000 and $5,000 upfront. So when you see an advertised price, treat it as a floor, not the ceiling. Cheap estates might surprise you. Now let's talk geography, because this is where it gets interesting. States like Missouri and Texas sit near the bottom. Monthly costs around $4,000 to $4,500. That's almost $2,000 less than the national median. Generally, the Midwest and parts of the South run cheaper. Lower real estate costs, lower labor costs, lower overall pricing. But cheap is relative here. Even in the lowest cost states, you're still looking at nearly $5,000 a month. Compare that to the average Social Security check. About $2,071 as of January 2026. That's less than half of what assisted living costs, even in the most affordable parts of the country. So if you're budgeting based on Social Security alone, the math doesn't work. Not in any state. This is why so many families end up combining income sources, savings, pensions, sometimes selling the family home. We'll get into those funding strategies later, but first you need to know what you're funding. What most people don't know is this. The most expensive states aren't always the ones you'd guess. The most expensive states will shock you. At the top of the list, things get extreme. The District of Columbia leads with costs over $11,000 monthly. New Hampshire follows with annual costs around $84,000. Massachusetts and New Jersey also sit near the top, often crossing $7,000 a month. Alaska is another outlier, averaging over $7,000 monthly due to remote logistics. Notice something about these states? High cost of living, sure, but also dense regulatory environments and higher labor costs. Staffing shortages are pushing prices up almost everywhere. Some regions have seen costs rise nearly 10% in a single year. That's well above general inflation. So if you're in one of these high-cost states, and you're planning for a parent or for yourself, the $75,000 average isn't your number. Your real number could be closer to $100,000 a year, or more. This is why state-specific planning matters so much. A national average can badly mislead your entire financial plan. Quick pause, because this next part changes everything. If financial planning content like this is useful to you, subscribe now. We break down real numbers like this every week. No fluff, just the math that actually matters. Okay, back to the breakdown. Before you assume assisted living is your only option, listen to this. The comparison most families never run could save you thousands. Assisted living versus in-home care, the real comparison. Here's something that surprises almost everyone. In-home care often costs more than assisted living. In 2026, home health aid services average around $6,800 monthly. Homemaker services run close to $6,700. Compare that to assisted living's median of $6,300. So in many cases, moving into a community actually saves money, while providing more structured support. This flips the typical assumption on its head. Most people think staying home is automatically cheaper. It's not, once you factor in around-the-clock care needs. That said, this only applies once care needs become significant. A few hours of help a week is obviously cheaper at home, but full-time support changes the equation completely. The takeaway? Don't assume. Run the actual numbers for your specific situation. Hours needed, hourly rates in your area, versus monthly community fees. The cheaper option isn't always the obvious one. How most families actually pay for this. So how do real families cover these costs? Personal savings and Social Security are the most common sources, but they rarely cover the full amount alone. Long-term care insurance is the next major piece. If a policy exists, it can cover a significant portion. Some policies even cover home modifications and care coordination. Veterans and their spouses have another option. It's called aid and attendance through the VA. It can help cover assisted living and personal care costs. Eligibility depends on service history, income, and care needs. Medicaid is the fourth major piece, but it's complicated. Coverage varies enormously by state. Many states cover care services through waiver programs, but not always room and board. And not every facility accepts Medicaid residents. The final option many families consider is the home, selling or using equity from a primary residence. For many older adults, this is their largest asset, and it can fund years of care. The key is combining these sources strategically, not relying on just one. The surprising part comes next, and it's about timing. Here's the biggest financial mistake families make: waiting until there's a crisis to start planning. Costs have risen roughly 3% annually since 2021. That's steady, predictable, and easy to plan around. But most families don't plan. They search during an emergency, usually after a fall or hospitalization. At that point, you're not comparing prices. You're just trying to find an open bed. This is also when costs feel highest. Because you're paying for urgency, not value. Families who plan 2 to 3 years ahead do something different. They research costs in their actual target area. They check long-term care insurance policies before they're needed. They explore VA benefits while there's time to apply. And they often find facilities offering better rates for advanced planning. The pattern is consistent. Early research equals lower stress and often lower cost. That $75,000 number from the start of this video? It's not scary if you have years to prepare for it. It's only scary if it shows up overnight.